Let's give the Frederick Douglass Marching Band a hand. Yeah, let's give it to them. All righty. So welcome to Total Health Care's annual Black HIV/AIDS Awareness Day event. My name is Faye Royale Larkins, and I'm the CEO of Total Health Care. On behalf of the Board of Directors of Total Health Care and our staff and our supportive community partners, I'd like to welcome and thank our distinguished guest, the Honorable Stephanie Rawlings-Blake, Mayor of the City of Baltimore, State's Attorney Marilyn Mosby, Delegate Antonio Hayes, Councilman Nick Mosby, and Dr. Leanna Nguyen, Baltimore City Health Commissioner. Thank you. On this day, which has been designated as National Black HIV/AIDS Day, we have a greater opportunity than ever to reverse the HIV/AIDS epidemic in African American communities. Over the past several years, Total Health Care has made HIV prevention a key priority by working with others to empower our community and create awareness around HIV/AIDS. While much has been accomplished in the battle against HIV/AIDS, for example, the rates of HIV testing are growing, and we now know that early treatment means improved health and longer lives for persons living with HIV. Despite this progress, we face a very sobering reality that we still have much to do to make these types of events celebrations of overcoming the HIV epidemic. Our community continues to be devastated by HIV. The impact of this epidemic is far-reaching and touches us all. Did you know that Baltimore has one of the highest infection rates in the country? Did you know that an increasing number of new infections are occurring in our African American youth? Did you know that HIV is the third leading cause of death among Black women in their prime, ages 35 to 44? We have no choice but to get involved and continue to spread a message of awareness and hope based squarely on prevention, detection, and early treatment. Today, I call on each of you to continue the fight against HIV/AIDS, and I encourage you to reach out to your family, your friends, and colleagues to get educated, get tested, get involved, and get early treatment. Together, we can end this epidemic. Remember, HIV is preventable. At this time, I have the honor of introducing our city's leader, who has been a strong advocate and warrior in the battle against the HIV epidemic in our community. I commend and thank her for making HIV/AIDS a top priority by dedicating resources to the fight against this disease. Please join me in welcoming the Honorable Stephanie Rawlings-Blake, Mayor of the City of Baltimore.
Good afternoon, everyone. Faye, thank you so much for the kind introduction. It is a pleasure for me to be here with all of you and all of our honored guests who are with me on the stage. We are here for a very important reason. And when I say here, I mean not just up here this morning, here in this community for a very important reason. We are here to bring attention to a subject that continues to have a major impact on our city. And I don't know about you, Faye, but I'm tired of it having a big negative impact. I'm waiting for us to get to a place where it's a positive impact and we're celebrating the news of the reduction in transmission rates, the reduction in death, and that's why we're here. 15 years ago, National Black HIV and AIDS Awareness Day was created to encourage people to get educated, to get tested, to get involved, and get treated. So today, we are here to stand up for those we have lost to HIV and AIDS. We are here to stand up for those who are still struggling with the disease and all of those who may be facing prejudice and discrimination because of their condition. And we are here for all of those who are supporting those who are in treatment and need to seek treatment. Since the early 1980s, the face of HIV and AIDS has changed. Once considered a disease that primarily affected our homosexual brothers and sisters, HIV and AIDS now afflicts people from all walks of life, regardless of their sexual orientation, regardless of their age, regardless of their socioeconomic condition. This is a disease that impacts all of us. The worst part, and the reason why it's important that we're here, is that that African Americans continue to face the most severe burden of HIV and AIDS. Let me say it a different way. We have higher rates of transmission, higher rates of getting HIV and AIDS in the African American community. In fact, approximately 1 out of every 16 black men and 1 out of every 32 black women will be diagnosed with HIV during her lifetime. The most tragic news is that black youth represent more than half of all HIV infections among young people. So that is across our country. Black young people represent more than half of new HIV infections. We can do better than that. In spite of those grim statistics, today we stand united in recognition of the more than 13,000 people living with HIV in Baltimore City. Across the board, we've made a great deal of progress in our fight against HIV and AIDS in Baltimore, thanks to the leadership of the Baltimore Health Department and with partners like Total Health Care. Prevention efforts have helped to maintain the stability and overall level of HIV infections among African Americans for more than a decade. In fact, between 2009 and 2011, new HIV infection diagnoses went down 25%, moving us closer toward our Healthy Baltimore goal of 2015 of mitigating the spread of the disease. And to further reduce new HIV infections, we are constantly offering HIV testing for high-risk individuals at community events across our city, continuing to improve access to quality care for HIV-infected individuals. In partnership with Johns Hopkins University School of Medicine, we've recently launched Protect Baltimore, an initiative that will encourage nearly 90 medical practices and more than 200 primary care clinicians to make HIV testing part of patients' regular health screening, regardless of their risk factors for their visit. So there's no need for anyone to suffer in silence. Without treatment, HIV leads to AIDS and can also lead to early death. But that does not have to be our story. So I encourage everyone to get educated, to get tested, to get involved and get treated. And I know with your partnership, with the leadership that we have locally and at the state level, and with my new dynamic health commissioner, Dr. Lena Nguyen, we're going to change the story of HIV and AIDS in Baltimore City. We're going to change the story of HIV and AIDS in our African American young people. And I look forward to standing here next year to have a better story to tell, a brighter story, a hopeful story about what we're doing in our community. Thank you so much. And I'd like to bring up our Health Commissioner, Dr. Nguyen.
Good afternoon, everyone. Thank you, Madam Mayor, for your comments highlighting the importance and significance of National Black HIV Awareness Day. And thank you to Total Healthcare and to the Mondawmin Mall for hosting us this afternoon. Total Healthcare is a fantastic partner in the city, providing services to more than 1,000 Baltimore residents who are living with HIV/AIDS. We need this fight against HIV/AIDS in our city. As you heard from our mayor, Baltimore has been hit hard by the HIV epidemic. In our city, we have more than 13,000 people living with HIV/AIDS, and every year, nearly 500 of our residents are newly diagnosed with HIV. That's more than one person diagnosed with HIV every single day right here in our city. you heard our mayor talk about how African Americans are disproportionately affected by HIV. In addition to all the scary statistics she mentioned, I'll mention one more, which is that our African American counterparts are 5 times more likely to die from HIV than our white counterparts, which is just not fair and not the right thing for us to stand for in this city. Let me give you one more scary statistic. This is the one that actually scares me the most on a day-to-day basis. 1 in 5 people here in Baltimore who have HIV don't know that they have it. That's 2,600 people who are living with HIV in our city who are potentially infecting other people because they themselves don't know that they have HIV. So what does all this mean? It means that we cannot wait. We cannot afford to lose the next generation to this potentially deadly but preventable disease. And it means that we must reduce the burden of HIV that in particular our African American men, women, and youth must face. So I want to talk about the things that we can do, specifically 2 things that we can do. As our mayor said, we have to do more, we have to do it today. So the very first thing we can all do is to get tested and know your status. You've got to do this every year. You've got to encourage everyone around you to do it. And as Mayor Rawlings-Blake said, it's not just about certain types of populations who need to be screened, it's all of us. We are all at risk. And so if you're negative, you can do more to prevent yourself from getting sick. But if you're positive, you should know that HIV is not a death sentence, but that you have to watch out for yourself. And it's so critical to take care of yourself in this process. Second thing, spread the word. The theme of this National Black HIV/AIDS Awareness Day is, I am my brother's sister's keeper, fight HIV/AIDS. And that emphasizes that we all have to take part in the struggle to fight the HIV epidemic together. And so today I'm pleased to say that the health department is here providing free HIV and syphilis testing from noon to 4 p.m. That's free and confidential just outside our mall here. And we provide free confidential testing at our 2 health centers at Eastern Health Center and Droid Health Center. You don't need an appointment, and it's always free and confidential. And so I hope you can join me and Mayor Rawlings-Blake to continue to mark February 7th of every year as the annual day to get tested for HIV. We are our brothers and sisters keeper. We can fight the epidemic of HIV together, and we have to protect ourselves and make our city healthier. So now for another voice, a true leader in this fight, a real advocate in our communities. I'm so pleased to introduce you to Councilman Nick Mosby.
Good afternoon. Come on, we can do better than that. Good afternoon. So first and foremost, Faye, please never invite me out and have me speak after Dr. Nguyen, because I don't know. She took all my points, she had all the energy, and I'm not sure I'll be able to outdo that. Today, we stand here today not for a celebration, but for awareness and for action. And like the mayor articulated, it's critically important that we don't pass this fight on to our children's children. This is something that we can end today. We understand and know the way that AIDS and HIV impact our communities through East and West Baltimore. But we also understand and know a critical point that Dr. Nguyen brought up, and that's the fact that it's treatable and, more importantly, preventable. So I encourage and urge each and every one of us. I don't care if we're in the healthcare profession and we work for Total Healthcare. I don't care if we're randomly walking around the mall today. I don't care if we're part of the media. But I say that all of us go and get tested, because it starts with us. We can all come together, but individually we can change this in our city. And we have the partners to do it. We have an institution in Total Healthcare. We have a mayor who truly understands the importance of going after this. And we have a dynamic health commissioner in Dr. Nguyen. So I make a pledge to you, and I ask that we make a pact today that we not only get tested, but we make it a germ. And we get our folks tested, our neighbors, our family, our friends, because that's how we end this epidemic for generations to come. And for the next generation, during AIDS, Black AIDS and HIV Day, It won't be a day of awareness. It won't be a day of action. It'll be a day of celebration, as our Madam Mayor eloquently said earlier. So thank you, and again, please continue to spread the word. Total Healthcare, thank you for all your leadership and partnership. Madam Mayor, thank you for all that you do. And Dr. Nguyen, thank you for all you will do for the city of Baltimore. Next up is an amazing young delegate who's gone down to Annapolis to represent this district. I had the pleasure of introducing not only my delegate, but also my friend, and that's Delegate Antonio Hayes.
Good afternoon. I have the pleasure to represent some of the most dynamic and diverse neighborhoods here in Baltimore. And I'm glad to join a podium today with Madam Mayor, Councilman Mosby, Dr. Nguyen, and our fabulous partners from Total Healthcare. The area codes that are most affected by this, and this location was not chosen by coincidence. Those people who live in 21215, 21216, 21217, this issue of HIV and AIDS have hit those communities at rapid rates. And so Dr. Nguyen and others encourage you to get tested, and I echo that sentiment, but also encourage your partners. If you're going to be engaging with partners, make sure that they also was tested, especially if they're in those zip codes 21215, 21216, and 21217. I'm proud to represent you in the state legislature. One of the things that are of utmost important to me to provide quality health care for people from some of those very important zip codes is the health insurance that we just received the governor's budget about 2 weeks ago. And serving on the health care committee in the state legislature, we're looking at losing $625 million in Medicaid. And so that is an important service that helps provide healthcare access to people not only in those zip codes, but throughout Baltimore. So I urge you to pay close attention and help educate your neighbors. I stand between you and a very dynamic leader whose testimony I think that all of us need to hear. He's a resident and a constituent. Mr. Alex Brown is bringing to you his testimony about how he's been fighting with this dramatic thing that's been causing a lot of tragedy in our neighborhoods. And so I introduce to you Mr. Alex Brown.
Good afternoon, everyone. Everything so far that needed to be said has been said. And I'm up here with a dynamic group of individuals, you know, some very powerful individuals, and individuals that can make some decisions. But how I got here is a whole different route. First, let me just say this briefly, is that I've worked in the field of HIV prevention and education for the last 25 years as a health educator, group facilitator, HIV counselor, tester, etc. But what got me into this field was when I go back to my college days, or when I was a student at a specific university, and I lost both of my parents to this deadly virus. It was back in the 80s. And I'm gonna talk fast because I don't have a lot of time, but I'm just gonna make a point. I lost both of my parents because they were IV drug users to HIV. One passed in 80, one passed in 85, something to that effect. That devastated me. That molded my life. That actually pushed me to do what I chose to do as a career. It's not what I studied, but this is what I was meant to do, which was to educate individuals about HIV. Okay, after watching my parents die a horrible death, right, back in the 80s, which was very scary, I was then diagnosed with this virus. I was diagnosed probably in 1986. And I probably would not have gotten tested. Check this out. I wouldn't have gotten tested because of fear. Not that I didn't know that it existed, but out of fear. Not that I wasn't doing things to contract this virus, but out of fear, I wasn't getting tested. However, I was a student and an ROTC student, and I had just received my commission, and in order to go into the Army, you had to take a physical. So upon taking this physical, it was then discovered that I too was infected with HIV. Now watch this. From 1986 to 1996, I did absolutely nothing. One more time. For 10 years, I did absolutely nothing. I didn't say the word HIV. I didn't go get medication. I didn't think about it. I did nothing. I did nothing about it. Meaning that if an intelligent individual like myself could walk around 10 years with this virus, but out of fear, out of rejection, out of stigma, out of all of those things that I knew that my own mom's, what's up, Donald Brown, that my own mother had experienced, I didn't want to experience, so I kept my mouth shut. The reason I speak about that, because there are still individuals that are walking around this mall right now that have a strong inclination that they may be infected, but don't want to talk about it. Some of them may have even been tested, have received a diagnosis, and don't want to talk about it. So the key really is to be tested. And once you test it, you got to do something about it. I believe that once a person is tested, and if you're tested and you just happen to be HIV positive, you need to go into treatment immediately. You don't need to wait. You don't need to worry about this, that, and other. You need to start treatment immediately. Maintain that CD4 at a certain level. Hit it hard. They're testing right over here right now. Anybody within the sound of my voice, whether you're married, single, in a committed relationship, you still need to be tested. You really have no idea what partners do. You really don't know what a partner do. You really don't know. A lot of people, you know, I think that you can look at me and see that I'm infected. I think so, but some say that you can't. And I've been living with this disease for 30 years, and I am AIDS defined. You know what I mean? But everybody might not notice that. And there's a lot of individuals that walk around with this virus you'll never notice. You know, the only way to know a person's status or your own status is to be tested. You can't ask a question. I can tell you anything. I can tell you anything. Thank you very much for your time.
So it's critically important that we are here on National Black HIV and AIDS Day to talk about how we can reduce the transmission of HIV and AIDS in our community and how we can get more of our people treated. We die at a higher rate once we've contracted the disease, and it's because we don't seek proper treatment, and that's what this is about. We want people to get tested, to get treated, to get educated, and get active and make sure that more people in our community are doing what they need to do to protect their health.
It's absolutely critical for everyone to know about their HIV status. It's not just certain types of people who have HIV. Any of us could get HIV. In fact, we know that 1 out of every 3 people with HIV now got it from heterosexual intercourse, and 1 out of every 2 new diagnoses are for people over the age of 40. So it's something that all of us have to know about. One more thing as well. 1 in every 5 people living with HIV in the city of Baltimore don't know that they're HIV positive. And that means you have to know whether you have HIV, because then you can take steps to prevent it and to spread it to other people.